When adults and elders are abused or neglected, it is difficult to know when to step in and offer help. However, across all of Canada, in every province and territory, there are agencies in place to support and assist abused or neglected adults, and laws that address most situations that involve abused or neglected adults and elders. Sometimes it can be hard to define abuse, neglect, or self-neglect. Other times it can be hard to know when an elder wants or needs help, or even to know if they can get it on their own. It is important to follow certain principles that will guide the actions and promote and provide support and assistance to those in need. Well, there are some legal tools that certain agencies, which we call designated agencies, can access for more formal interventions. There is a lot that communities can do to make it safer for their elders and other vulnerable adults. A coordinated community response involves anyone who cares about stopping abuse or neglect. This can be called a community response network. Your community may already have one. If not, perhaps it is time to create one.
Hi and welcome. I'm a community health worker. I work in the band office, and it's my job to liaise between patients, families, the community, and healthcare providers. I ensure that patients and families understand their conditions and treatment and are receiving appropriate care. I'm also a member of the Community Response Network, and she is our Community Response Network coordinator.
I'm glad you can join us. Abuse and neglect are complex issues that require the experience and the concern of many people and organizations to be effectively addressed.
A community response network is a group of people from community organizations and other concerned community members who work together to create a coordinated response to adult abuse and neglect. Often, community response network members are employed by service agencies such as the band's health services, the local church, the police or emergency services personnel, and the restorative justice program. Sometimes, members are volunteers who work with elders, and we even have elders who come to our meetings.
We develop relationships, agreements, and protocols among members about how we will respond as a community when an adult needs our help. Our goal is to prevent abuse from happening in the first place.
I am an emergency health services staff member. Unfortunately, many adults wait until they're seriously physically injured before asking for help from an abusive situation. Abusive behavior is not restricted to one family or community.
As hard as it is to ask for help from family, friends, or community members, the sooner we start talking about abuse or suspected abuse, the easier it will be to break the silence and prevent adult abuse and neglect.
I'm the social worker, and I work for the designated agency. I'm part-time at the hospital and part-time in the community. Depending on where you live, designated agency representatives may work for a local regional health authority or some other adult protection or social services agency. In general terms, we all assume that adults can take care of themselves and seek help if they need it. But in some cases, adults cannot seek help because they're more vulnerable. This may be due to a physical restraint, physical handicap, disease, illness, injury, or other condition that may limit their ability to make their own decisions. Things like depression, dementia, or alcohol and drug use can also make an elder more vulnerable to abuse.
If a designated agency receives a report about an adult, that agency has a responsibility to look into the situation and coordinate a response.
Designated agencies work with the adult to give the kind of support he or she wants and needs. This may include informal support from family, friends, and advocates.
If a situation cannot be resolved informally, is urgent or dangerous, your province's laws that govern adult guardianship or adult protection may give designated agencies additional tools or authority to help protect adults. Also, don't forget that many types of abuse and neglect are crimes and should be reported to the police. The Criminal Code of Canada is applicable in all provinces and territories.
That's right. These tools might include giving an agency the legal authority to get in to see an adult when access has been denied.
Short and longer term restraining orders to keep alleged abusers away.
And like she said, designated agencies should report suspected criminal offenses against vulnerable adults to the police.